Deputy Keaveney, question number 4.
Corla, the audits referenced in the question highlight that there are 18 recommendations between both audits, and I would like the Minister to share with the House today what action plans he's going to put in place with respect to the recommendations set out in the audits. Now, Corla, for your benefit, the audits involve an investigation into community mental health services, into approved centres and into the community setting that deal with the compliance or the non-compliance of obligations to report to the Mental Health Commission where tragically death by suicide by person within the mental health services take place. Now, I appreciate, Corla, that it's not entirely preventable within the mental health service. However, it is essential that we get to answer this question if we are going to learn anything from what we would regard as the greatest public health crisis in this country, which is death by suicide.
Minister.
Just to thank the Deputy across, it is important that mental health services, as with all parts of the health service, are subject to periodic review or audit where issues of potential concern are identified. Such review processes facilitate services to improve the quality and safety of the care and treatment provided by identifying any matters of concern and making recommendations as to the steps necessary to address these. In 2013, as part of its patient safety and quality process, the HSE Mental Health Services and Quality and Patient Safety Directorates requested an audit of compliance with regulatory requirements and the HSE policies and procedures in relation to the notification and investigation of incidents of sudden unexplained deaths of persons in community mental health services. The HSE audit report was completed on the 15th of January 2014. The report concluded that, based on the information submitted, the audit team could not provide assurance that incidents of sudden unexplained deaths of persons in community mental health services were being notified in accordance with the HSE policy and procedures, nor could it provide assurance that incidents of this nature were investigated using the systems analysis methodology. The audit report made a series of detailed recommendations in relation to the notification, recording and investigation of sudden unexplained deaths of users of mental health services. The HSE is taking steps to ensure that each of these is addressed. In March 2014, the National Director of Mental Health Services issued a memorandum to all relevant managers re-emphasising the requirements in relation to the reporting of sudden unexplained deaths. Work is underway in conjunction with the Mental Health Commission in respect of 2 recommendations. The Executive is also working to ensure that the other shortcomings identified are addressed through appropriate performance management and service improvement processes. And can I say to the Deputy across, I share his concern and I find this totally unacceptable. Sudden deaths should always be recorded and explored. This is how we find out if there is unintended consequence from some of the treatments that some of our patients take. And this is what came across years ago with one particular drug which was causing cardiac rhythm problems. And had it not been investigated and the issues recorded, it would never have come to light. So I take this matter extremely seriously, and I want to thank the Deputy for raising it.
Thank you.
Corla, I'd like to welcome the Minister's alarm. It was only last week that officials from your own department rang my own office looking for the report, and it is a source of great concern that the consistency with the Minister's alarm with respect to the officials in the department would raise some questions. In light of the fact that you would have to contact somebody from the opposition benches to identify what report are we referencing. Now, Minister, of the 2 audits, one was involving a community mental health service. There are some particularly startling details. Minister, fewer than 25% of the incidents involved in the investigation were notified in accordance with the law. Half of the incidents were investigated did not actually provide for a review with respect to the deaths involved. The standard review was performed, but largely there is no standardised approach within the service. And startlingly, Minister, there is no evidence to suggest that there was a plan developed subsequent to establishing an investigation, that an operational plan around what had been identified in the investigation was provided for within that centre. Minister, could you comment on the fact that we have had 18 recommendations since January, and what actions you have taken with respect to the 2 audits? I would be alarmed if it only came to your attention last week, this report.
Thank you.
Well, just to assure the Deputy that there are recommendations and that they are being put in place. The HSE Mental Health Division, in conjunction with the Mental Health Commission, should review the completeness of the notification circumstances to ensure that sudden unexplained deaths in persons in receipt of services from more recently developed service models will be captured, that is, home care and assertive outreach programmes, etc. That the HSE Mental Health Services should ensure that a record of all patients notified of an incident of sudden unexplained death is kept. That the HSE Mental Health Services should ensure that incidents of sudden unexplained deaths of persons in community mental health services are investigated, and that the systems analysis methodology is applied. And the HSE Mental Health Division should ensure that services are fully aware of and compliant with the process involved in documenting the development, monitoring and review of service users' individual care plans as set out in the Mental Health Commission document on individual care planning in 2012. And the full list of recommendations is available and can be forwarded.
Thank you. Deputy Keaveney.
Minister, it's a fact that there's been a general failure to investigate the contributory factors to the deaths involved. The report itself clearly indicates that the approach by the department to fail to adhere to the legislation and the regulation has resulted in a collapse in a standardised approach. Minister, only 1 in 8 of the investigations undertaken were consistent with the approach set out by the systems analysis methodology that you referred to. That is 1 in 8. And Minister, that is unacceptable. If we are to learn anything from the crisis that exists within our country with respect to death by suicide, we need to establish where the systems are breaking down within the HSE, and why is it that validation of compliance was not possible in cases due to, for example, the lack of supporting documents, maintaining files, adhering to standing operation procedures. Minister, we're failing the most vulnerable people by our absence in ensuring that we're following the procedure in terms of the regulation in this respect.
Minister.
Look, I view this matter very seriously. I've pointed out what has been recommended. I note the word should appears an awful lot here. As far as I'm concerned, the word should will be replaced with the word will. These are the most vulnerable people. They cannot speak for themselves. There is a requirement for us to look out for them and to speak up for them. And I will ensure, with Minister Kathleen Lynch, that these audits are properly carried out, that investigations are properly supervised and reported, and that we get proper information and that we get it speedily. And there will be a range of consequences that will have to be developed for those who do not perform as per their contract and as per their duty. Thank you.
Thank you.